All right, when people discuss the use and abuse of drugs, they often determine heroin is the most addictive drug out there. They say that one hit of heroin or one injection, one snore, one line of heroin, anything, you are almost instantly addicted. And that's because the withdrawals are almost immediately once the feeling is over with. You start having withdrawals almost instantly. The implication is that heroin is so powerful and so addictive that people who take the drug are almost certain to develop dependence almost immediately. Quite often, people who have experimented with their drugs are curious about what heroin high feels like. The high comes from feelings of euphoria, which is one of the main reasons people use heroin and get for taking this dangerous drug. However, it comes with the very adverse effects as well, which many of those who use it for the first time find very unpleasant. The heroin high for many people who take this substance is more about avoiding and numbing the pain to feel good. Compared to other drugs such as alcohol, cocaine, marijuana, those are more used in a social and public setting. Heroin is used more as a self medication kind of drug. Um, Heroin is a high association with comorbid anxiety and depression, which suggests that people take the substance to help them cope with symptoms of mental health conditions and whatnot. After a hit of heroin, a variety of chemical changes flood the brain, instantly giving people a feeling of pleasure. This rush of euphoria feels very important to those who do not feel good in the first place. This is despite the rebound effect, which actually worsens unpleasant feelings over time. Um, People who use heroin describe sensations of warmth and safety while they are high. This may be despite the fact that in reality they are anything but safe and warm. People who are homeless or living on the streets in the cold and whatnot, who are living in an unsafe environment or in a certain kind of hood or something like that, they may use heroin and they use it in a way to express a feeling of euphoria, make them feel like they're safe, and that's what heroin does. Um, at lower doses, heroin can make a person feel calmer, less tense, and lonely, and more accepting to those around them. However, at higher hits of heroin, it can reduce this kind of people will disconnect from those around them and experience a kind of floating like dream state or euphoria. This can be a relief of someone with high level anxiety or depression, or those who feel alienated from the people and the world around them. The dangerous effects of heroin is one, obviously, it can result in an overdose and you can die from it. With it being one of the most addictive drugs out there, you don't want to even attempt using this drug or trying to have fun with it. It's just not a good idea. Many people find heroin very unpleasant the first time they take it and never do it again. However, the effects that heroin has on the nervous system can cause immediate vomiting. When combined with suppressed breathing and the coughing reflex, this increases the risk of choking. Heroin can also cause constipation. Heroin also reduces the sex drive and the ability to have an orgasm, unfortunately. Fillers and other drugs are often mixed with what is sold as heroin. The amount of actual heroin is unpredictable, so it is impossible to know. You never know what you're getting, especially when you're buying an illegal drug off the street. You never want to take it in the first place because there's no telling what's in it, what if the drug's even safe. And for example, heroin is not even safe. So why even do that? Heroin also carries a very high risk of death by overdose. The risk does not decrease with experience because the body develops a tolerance to it very quickly. Changes in body weight, the route of administration, and periods of abstinence or reduced use also affect how much the body can cope with. One of the biggest surefire signs of heroin are weight loss. You can tell when somebody's on it. They could be 300 pounds. They use heroin, they go down to 150 easily within a matter of no time. The harms associated with heroin use are potentially deadly. I mean, you can die from this stuff. If you inject heroin, um, I mean, find a needle that, nobody's used before. Find a clean needle. There's no reason to even risk, using a needle that somebody else has used. That's one, disgusting, and two, why would you do that? It's like the same principle. If you're gonna have sex, use a condom. If you're gonna do heroin, use a different needle. Which, don't do heroin. I mean, it's the most addictive drug out there, and it is deadly. It is proven to be deadly, and almost 5 in every 100,000 people die from it every single year. Some people are able to manage the controlled heroin use, but for those with long-standing emotional problems, a history of trauma, chronic pain, or a disadvantaged lifestyle, the risk of heroin addiction is actually really high. And because of that, is because of the euphoric state that heroin puts you in, you are naturally drawn to it to where it'll take away those problems that you were having and filling it with a euphoric state. If you have problems, with a family member or anybody using heroin, reach out to somebody. I mean, this is not a joke by any means. Help somebody who's in need. This is a real deal. This is an epidemic. It has been an epidemic for going on 22 years now. It started back in 1999 to where it started, progressively climbing, and it's only getting worse. And in 2017, 2018, you saw a slight decline in it, but that's not a good result. The result should be zero. Help people who need it.